Hi everyone, welcome to our video. In this video, we will explain you about hospital group. Before that, let me introduce myself. My name is Nilo Sugandari, and here my friend will help me to explain this material.
My name is Kadera Ratnasari Dewi, and
my name is Gede Sukurawan.
Okay, so firstly, I will explain you about an outpatient admission process. So there's two types of an outpatient admission process. There's new patient and old patient. New patient means patient who never come to the hospital, and for old patient means a patient who ever come to the hospital or regularly come to the hospital. So an outpatient admission process for the new patient. Each new patient is accepted at the new patient admission point, or we call it cashier or recipient, and will be interviewed by officer in order to obtain identity data to be filled in the form of clinical history. Each new patient will receive a patient number to be used as an identification card, which must be to be carried on each subsequent visit to the hospital. After completing the registration process, new patients are welcome to wait at the polyclinic, and the officer will prepare a medical record. And an outpatient admission process for an outpatient. If there an outpatient who ever come to the hospital and already make an appointment, they will be interviewed and wait in the polyclinic. As for any outpatient who's ever come to the hospital but doesn't have an appointment, they will be interviewed and given an appointment slip. In the appointment slip, there's a date and time to the patient to come again to the hospital.
Okay, now I will to explain about an inpatient admission process. Firstly, the patient enters the emergency department and the patient family will be interviewed for registration. Then the doctor determine and diagnose the emergency of the patient. For a patient in need of help like a really bad injury, such as fractured bones, there will be surgical procedures as soon as they send informed consent. As for patients who have been diagnosed and need hospitalization, the patient will be taken to the ward according to the classification of the disease. As an example, for those with tuberculosis, will be hospitalized in an infectant ward.
next. So now I will give you a simple explanation with an example of patient with cardiac disorder such as stroke. For the many who living with stroke need to check up or control his disorder with going to the hospital at least once or twice a year. And of course, because his disorder, he will always have an appointment with the doctor every once or twice a year. We call Benny old patient because he ever come to the hospital and already have an appointment. Next. Firstly, at the hospital, they need come to the reception or cashier to interview or register. After that, the officer who work in reception will know where the patient need to go and the patient medical record. Next. Next. The officer will guide or give Benny the way to the cardiology department, and he need to wait the queue. In the cardiology department, Benny will meet cardiologist, doctor, cardiographer, and nurse. They will treat Benny with some of the necessary procedure and give Benny some prescription. Next. Then Benny need come to the pharmacy to take his medicine. That is all of hospital growth for outpatient with cardiac disorder. Thank you for your attention and see you in the next video.